Hello.
Hey Liz, how you doing?
Okay, thank you. I'm reading at the moment. I am just loving this book.
You know what? I did come across that a couple of months ago, but I haven't. That is a huge book. It's not like
I'm working my way through it at the moment. I'm literally reading it cover to cover. I tried dipping into it. I was thinking I need to read it. I'm reading every word, every sentence. It's just superb. It's
yeah,
she's integrated all the bodies. I'm just getting to the body section now. The beginning section is about, that's where she introduced the polyvagal theory and the way the body works and intertwines everything. I love it so much. She's done all the work for you, kind of thing. She's done all the connections, and then she's just getting into the body stuff, which my healing journey started with Alexander's technique, and sadly my teacher moved away, who was superb, but I still take so much with me. But her way of working body wise, but integrating wise, she's a good friend of Stephen Porges. They've worked together a lot, and all, I mean, all the people that are recommending her, Peter Levine, Gabor Mate, Bessel van der Kolk, she's got the lot.
yeah. She's got the
and for good reason. It is superb. It really
yeah.
is.
So
I'm
that
working
book's
on
the human manual. Isn't that what it's called?
Manual. Yeah, the manual for being human.
Yes, yeah. I can't remember what I heard about that. I don't know if I heard about it. Maybe I think it was an interview with Peter Levine, and he a couple of months ago, and he mentioned it, and I was almost going to get it on Audible. I love listening to books on Audible, but after seeing you hold up that book, it's not exactly looking like an Audible kind of book.
No.
It's like it really is like a manual.
Oh, it really is. And there's so many beautiful pictures. She demonstrates all the movement so well, and she's got it's so accurate. How you pick something up with your skeleton and things like that. It really is. It is just brilliant. I mean, I'm always very fussy about anatomy and physiology because of my medical background. She's absolutely spot on. And the neuroscience, because I love neuroscience, she is 100% spot on. She's just brilliant.
All right,
it really is excellent. It really is superb.
Recommendation.
It really is just superb. It's just got everything. I'm already working on some things that she's talking about, just simple things like, she said most of us stand too far forward on our feet because we're about to rush in the fight flight kind of thing, just ready to go. So just rock backwards and forwards and see if you go back a little bit. And just by going back a little bit on your heels, straight away, you're more upright, you're more present, you're more open. I mean, just something simple like that. It's just so incredible. I love it.
And I think you're right. It does bring in, I did some Feldenkrais classes. So I know there's some similarities and different, to the Alexander technique. And that was a lot to really looking about your symmetry and your balance and your weight over your midline. And you're right, you do as you get older, and it is part of that kind of, I've got to keep moving, and everything starts to move in that more sort of anterior direction.
Like this, and it's our laptop
and the computer. Oh, I know.
And it's just like this, and it's just like, hello.
Yeah, I know.
It just makes such a difference being open here and just being aware. It's awareness, isn't it?
Yes,
And rather than being grounded, like we talk about being grounded, she said she doesn't do grounded. She says, and I'm playing with this as well, I have been with clients since I read it, it's like, feel the floor, but feel the support from the floor, your connection to the earth. And it's just like, whoa, hello. It's like when you're sitting, feel the support from the chair. When you're lying in bed, feel the support from the bed. It's a very different concept that you're getting the energy and the two different forces working, the down and the up, and receive the up.
Isn't that interesting, just the shift in the words of, you feel grounded to the earth, that kind of brings you down. But you're right, if you just sort of say feel the support, and you feel like it kind of elevates you and will create a little bit more energy and stuff. Yeah.
And that's what she says. Grounded sounds very heavy. People feel heavy when they're grounded. And she said, no, feel the support. And it's just lovely. It's the way it's that awareness.
Well, thanks for bringing my attention back to it again, because I'd come across it and got sidetracked onto some other things. And was contemplating, because you can get it on Audible, but it doesn't look like that would do it justice whatsoever.
For me, no way, because and each sentence, almost certainly each paragraph, I had to go away and think about it. It's not something to, and that's why I'm marketing it so much with books. I want to go back. I want to get to the end, but I want to go back to certain bits because of the way that they'll connect and different areas. It's an Audible would be great, I suppose, to listen to first of all, but I certainly want to go back, and it really is a manual to keep on looking for. Well, for me anyway. It's
yes, and by the sounds of it, it sounds like it's stuff that we can bring in to our sessions to support the Safe and Sound protocol. Then is that what you're finding?
Oh, definitely. And my own self-care. That's that's if I can be present and look after myself. So I'm reading it from a personal point of view, but also a professional point of view. And she talks about, there's one chapter on trauma. But if we don't understand the healthy and how we're meant to be working, then we can't understand what we're trying to go to as well. And it's the understanding, and the way that she's integrated everything as a human being. And it comes after her first book, which I've got as well, but I haven't looked at yet. So it's The Actor's Secret, because she works with people at Boston University, performers, and so much to do with social engagement and the voice and those sorts of things. So, and that's so much our area in SSP as well, and breathing. So I will go on to that book afterwards, because that feels like it's much more specific. But I don't know, for lots of people with SSP, they have problems with their voice or hearing. They don't even know it until, again, you get the shift. And then, in fact, I was working with someone yesterday, and I hadn't even noticed her voice was so much better. And then we started talking about something she was nervous about, and I said, oh, did you notice the difference in your so it's those kinds of things that, if we have an understanding, we'll have more of an idea of how to pick up those changes, because we don't often know what's available. And then we can track the changes for ourselves and for our clients as they go through, and through their day, and through the SSP as everything opens up. So but I'm just fascinated by it. I just love this whole, the physiology, the anatomy, the neuroscience, everything connected, the complex beings that we are as humans.
And the totally integrated approach. And I think from some of the learning that I've done with like I said, I had experience with Feldenkrais, and and what we know about SSP, it's always less is more. And I think that sort of terminology just speaks perfectly to things like Feldenkrais. I'm sure Alexandra technique, I've never had that experience myself, but it's almost the intention, like the tension to subtly move. You're not necessarily doing all the movement, the subtle movements, and the intention. And it's that minute, less is more. And you actually get that unraveling of the tension in those tissues with that little subtle sort of movement, which I thought was just fascinating. That it just really resonated that less is more, rather than doing big pulls and stretches and yanking on different joints, trying to get alignment. But sometimes just thinking about it and doing tiny little shifts through the joint actually created bigger changes in the tissues, letting go and letting things sort of realign. Did you find that when you were doing some of the Alexander? Or?
But what you've just described is what we should be doing with SSP. We don't want big yanks. We want it to be integrated. If we try to yank, oh my gosh, that's beautiful, there'll be a retraction again. Oh my gosh. So what you've just described is something, it's an awareness of that. Oh gosh, those words are beautiful that you've just used.
Well, thank you.
Yeah, because if we work with the body, we have to be gentle with it, especially a traumatized body. And most of us have habits as a result of things that have happened, but we don't know them, and they build. And we want to slowly unwind those things, but we want to do it slowly and gently so that it can be integrated, and it's part of a beautiful process of transformation. We don't want to push it. And for me, that's what this work is about. And it's the work that I do for myself as well. It's like, how can I bring awareness? How can I do things gently? I don't want to have any huge shocks to my system. I've had enough in my life. I want to do things that are supportive. And that's what I want to do for my clients. I'm looking for those micro moments, those little shifts, so that we can, and I talk about listening for the whispers, so that the body doesn't have to shout, because we switch off from the whispers, because we have to, especially when we're going through life, we have to carry on powering on. And we want to do the opposite with this work. It's just like, so we can start listening to the little whispers that we've had to shut off, so that we can then respond to them. And then we don't have to wait for the body to shout with the huge issues, if we can do those gentle things. But that's something new to learn. It's like learning a new language. And we have to tune in, and we have to practice that language, and you have to practice with someone else, and learn from someone else, and try yourself. And it's not a linear program. It's integrating. It's life, and it should be gentle and supportive.
And I think you're exactly right. And I think, often we think we have to we're thinking we need to put more in to, and people feel therapy wise, they need to feel the response. But I think, at least just some of the work that I've been doing of late, that sometimes the subtle little bits of input that actually create that the body's been waiting for, and helps create a bit more change than. And I've just been exploring that even in some of, I'm not a very good yoga person. I try to explore, but I was have a background as an athlete where I did triathlons competitively, the long distance, and I ran marathons, and you finished and you stretched the muscles, and that you had to feel that pull in order to feel like you were making gains. And I feel like I've shifted my thinking so much now that when I'm looking to do work, flexibility work, whatever, that it is all soft and subtle. It's using the breath, waiting for the muscles. I don't put it under any tension. I wait for it to soften. And for me, it integrates all from a polyvagal, that we have these defensive mechanisms within our body that, we talk about it from a whole behavioral perspective, but we have it at a cellular level, that whenever the cells detect that there's some sort of foreign, sort of chemical or whatever in the blood and the environment, a whole defensive cascade starts to occur at a cellular level. But these defensive mechanisms are just wired into our nervous system at all different levels. And the same as when you start to stretch a muscle to what we, and sporting wise, used to think I'm going to, stretch out that tightness from my runs. Actually, the muscle is in a defensive state now, and will contract, and you're not achieving anything. So less is more, really, and our body really responds to that.
Wow, well, you've just said it. I love the things you were saying, like, it's what the body's waiting for. That's what I really feel with this SSP work, that it's the greatest gift to be able to deliver it to someone sensitively, to respond as their body. But we have to tune into their body and help them tune into their body, and that can be really difficult for their circumstances that we may or may not know about, and we don't need to know about, which is why I love the polyvagal work, because it's about features and behaviors, and we just work in the present. But the body's waiting for us, and we have to be sensitive to that. And try and help them come out of that defensive. And it's for us to know that, not for them. We want to help them become the experts for their bodies. But like you're talking about doing the triathlons and the marathons, it's about performance and personal best, and what that means to society. But what's actually our personal best? To live a whole bodied life, to that integrated life, to feel fully present. I mean, I'm still striving for it. I hope I'll get there. I was very performance orientated in my past. That's how I was brought up. It was how, exam after exam, and sports and music and all those different things that we had to perform at. And the expectations on us, no acceptance for who we might be or ourselves. And so it's a big switch, and to have a balance, I think that it's all about balance, and knowing where that balance is for each person and in their circumstances, because we work, we're not individual, well, we are individuals, but we're working in a community, we're in an environment, which is why I love the concept of neuroception, you know, the inside, outside, and between that Deb Dana talks about. I think that's a lovely thing. So I work with all the time, myself and with clients, that I'm thinking about their outside, what can we do to make their outside, give them more cues of safety in inverted commas, because safety can be a real luxury that many people with trauma never have, but less threat, and enhance their environment to make it a richer place for them. And the between is so important in our therapeutic work. What can we do to support them being able to reach out and us to be able to reach them, that in between? And then the inside, which is what we're working with, the interoception and those different parts, and trying to make the implicit explicit by using words, which is why metaphors are so helpful, because we're talking about right brain stuff, you know, subconscious stuff that's very difficult to find words for. So to try and find ways to open up those things, and also to be alongside, and that there's no judgment, there's no criticism, it's not binary, everything's fluid, and whatever is. So no rights and wrongs, that kind of thing. It's a very open, and it's often, people call me their Sherpa sometimes, or, you know, I like to feel that I'm their driving instructor. You know, they're trying to learn to use this body in a different way. We're taking off the accelerator and the brakes with the SSP, figuratively, and swerve a little bit. And how do we get used to that so we can learn to use our bodies in the most effective way with awareness, rather than driving forwards all the time, you know, like in your marathons and triathlons. I mean, that's not to say that sports aren't good, but there are ways of doing these things. And again, it's bringing awareness to ourselves in a way that sadly a lot of us don't have the opportunity for until things start causing problems. And that's when often people reach out for these therapies, and then we've got to start unraveling. But do that with huge respect for where we've come from, and no judgment, that we are where we are, and we don't know what we don't know. And that's why working in the moment, looking after ourselves, being in the moment to look after the person in the moment, and tuning in moment by moment, so important. It's a very different kind of work. So the SSP is this music, 5 hours of music, and it sounds like, oh gosh, I just have to listen to 5 hours of music. That's the tool, most extraordinary tool, profound tool that stimulates the vagus nerve through listening to music. But it's how it's delivered. That's the art of this, and the most important part of this, and it's what I'm passionate about. And it's changed so much, and it's still evolving. We're still learning all the time, and that's what I'm fascinated by. You know, I'm a bit of a sort of science. Well, I love neuroscience. I love anatomy and physiology from my medical background. I'm just fascinated. My whole body is my own laboratory as well, and I learn so much from working with my clients. You know, we've got it all here, and I don't do anything with my clients that I wouldn't do for myself. That I always check things out first of all. But it's huge respect for the incredibly complex creatures that we are.
And I know
wonderful creatures.
I know you've got an amazing way of how you integrate the SSP with everything that you're just talking about. So, you know, I know we chatted before, but you know, I'd love you to walk me through again when you first start with somebody. You know, what's your process, and if somebody sort of contacts you, interested in, I mean, do people always contact you directly now because they hear of the work you're doing with the Safe Return Protocol, or do you find you still get some referrals and then you're starting to weave in and introduce that as an intervention?
No, I know I've stopped on my other work. I do some research SSP wise and professional guidance, and I work with the clinical advisory team for Unite, and those are wonderful things to be able to do. But the work, my client work, is purely for SSP. I work in a polyvagal informed way, and I draw on my medical work, my knowledge, my clinical experience. I've had my own extensive history of trauma and worked with wonderful therapists, body therapists, psychotherapists. So I've learned a lot from that, from a very person-centered approach. So I've learned and integrated, and I use those things to inform the way that I work with clients. And people come to me now purely for SSP with a polyvagal informed approach. But I'm not a therapist, and I always insist that someone has therapeutic support alongside, because SSP isn't a standalone therapy. It is a platform for other therapies to work well. So it's really important there's anything that, because you never know what's going to come out from the SSP work. And so for them to have that safety net, and I talk about it as if when people say, well, I can't afford it, and I understand that money is a big issue, and that's a real struggle. It's a shame when people can't, but it's an investment, and it is a process for a certain period of time. And I say it's a bit like if I was a brain surgeon and I am working on a big cranial nerve, the vagus nerve, I wouldn't go into an operating theatre unless I had the physios and occupational therapists and the intensive care beds available, just in case. And so I say it's the same. We don't know what we're going to find, and I want you to have those safety nets, because it wouldn't be I have to be responsible, and I know what I'm working with, and I don't know what I'm working with. I don't know what I'm going to find, and I want you to have the best support you can have. And so it wouldn't be responsible for me unless I did go into this knowing that you had the support that you needed. And often people go off and they will get the therapeutic support and then come in, or find the time that's right for them. And that's really important as well, because I think people can get the wrong message about SSP, because it's this 5 hours of listening to music. That's all I have to do, put the headphones on, ta-da, magic wand, life's wonderful. This is the real world. And we're working with complex system, and most people have come to needing SSP. It's for very good reasons that have taken a long time to build up. And it's important we have the time to unravel those things slowly and allow time to integrate. And it's not just the time that we spend in sessions with clients, it's the work they do in between times as well. And I think it's really important that they realise that this is an active process. The listening is the easy bit. The actual impact on our systems and how we integrate those and work with them is the transformative bit. We use the SSP in the most extraordinary way. It is brilliant. I just love it. So I'm passionate about it, and it's just such a privilege to watch people change as they go through the program. But it's so important we don't overwhelm the system. It's, this is the vagus nerve. This is a huge nerve that connects brain and body. And just like you were talking about, and how it's there's everything, even at a cellular level, we just have no idea what's going to be happening. This wandering nerve goes over our heart, our lungs, all our guts. It opens up. 80% is going from the body up to the brain, only 20% down. And that's so important, that body-brain connection. And if we don't allow that to come on board, because often we're cut off at the neck through trauma, we're working in a very functional way above the head. We've had to cut off those sensations because they've been too painful. If we open those up, and that's where the pain is, or we open up the limbic system on top of the brainstem and all the emotions and memories that can come, we have to do that really slowly and respectfully. So I'm not really answering your question, I don't think.
No, you're doing it beautifully.
It's my sort of approach. That's when someone introduces themselves to me on an email, I'll ask them for more information to give me more of an idea. And even the way that people listening to this, they might think, oh, now I know what she's up to. But I, just by the way that they present themselves, even I get things. It's what's not said, it's what's said. But most providers are therapists. They'll have all these skills and already there. The way I speak is because I'm not a therapist, and so my way's quite, I guess, clean of other therapeutic approaches, but polyvagal informed, so other people can then integrate it. And I love working with other therapists and helping them integrate it into their practices. But the way that I speak, because I work with complex trauma as well, so my perspective is very much down one end of the spectrum of delivery of SSP. It's a long spectrum, so 30 minutes a day can be fine for a little child with autism, for instance. That's one end of the spectrum. I work at the other end of the spectrum, which is adults with complex trauma. So there's a spectrum and in between. And so I work often, this is what shocks people, and it shocked me when I started doing this work at the start of the lockdowns, when we had to go on working on Zoom. I'm starting to deliver sometimes 3 or 4 minutes every week, a session once a week, and that's often all we'll manage. And that shocked me. But the changes are profound, and they shocked me so much that I had to get in touch with Stephen Porges and say, and we had a conversation, and what on earth's going on? I'm getting incredible results by so little music. And he, he encouraged me and continues to encourage me and endorses my approach. And I continue to work and explore it, because it's not just the music, it's this inside, outside, and between. And so if we allow that connection, and people being on Zoom allows them not having to travel to your office, and having to go back again, so they're in their own environment. I encourage them to get beautiful things around them, things that smell lovely for them, that they feel really comfortable. We build a connection with each other, have some fun if fun's appropriate, or we're very low if we're, they're in a low state. Wherever they are, I'm attuning to where their energy is, so that they feel heard and seen. And then we drip feed the SSP in. But I'm always, it's the most active process. I have to be so present, watching for those little micro moments on their face, on their posture, on their anything. And if in doubt, when they're listening, I stop, check in with them. How's it going? There's no harm in stopping. And from their voice, from their way that they react, I can then see, whoa, okay, you're fine, let's go on. Or, oh, should we just do a little bit of regulation together? I won't call it those words. I use, in my back, I've got all the polyvagal language in my mind. I use everyday language. Should we just rock together a bit, sort of do a self-hug together? Or should we put some hand cream on together? Or, things that I'll be doing when they're doing the listening anyway. I try to keep eye contact with them anyway. I'm jumping around, aren't I? I realise you've asked me what comes in.
Basically, you're leading perfectly, because I was like, well, talk through what a session looks like for you, because I think that's why I think the beauty and why you're getting so much success is because you do embed the listening within such a polyvagal informed approach and a somatic approach, with you using, well, what's in the environment that brings cues of safety, and how do we build that into then like some sensory awareness through just something simple like hand cream on your hand, but being aware of how you like, how it feels going through your fingers. Does it feel in the back of your hand versus the front? If you put pressure on the palms versus the back. It's bringing all that awareness and just that sort of back and forth communication of engagement of I hear you, I'm here with you, and then using those cues of those observation skills that you're as a clinician that you see of like, okay, I see that your nervous system is ready, and whether you continue with another 3 to 5 minutes of listening and you pause again, but talk about, because you've shared with me before, but talk about some of these things you use, because I think they're beautiful techniques for other practitioners to know about, because some people feel how to, especially when we all first started working with delivering the protocol through a telehealth format, practitioners were like, oh, it feels kind of odd just sitting there while they're listening, what am I doing? Or do I turn the screen off? But you've developed a beautiful approach to do that. It's very active, it's very engaging, it's so polyvagal informed. So please continue.
Okay, so I always vowed that I could never not deliver SSP unless someone was sitting in the room with me, because I was monitoring their breath, I was present with them. For me, it was so important picking up those little nuances, feeling their energy, those kinds of things. And so when COVID hit, it's just like, whoa, okay, end of story. I was just like, and I was encouraged gently by Unite ILS to say, well, come on, Liz, you need to do this. If you're not going to, who's going, that kind of thing. I was like, I didn't want to. So I tried, when I first started SSP, I did it with friends. So I started doing it with friends again, who are very kindly happy to work this through with me, and then slowly built up practice. So I didn't want to do it at all. And now I will never go back to in person. And I would never, ever have thought that was possible. I just love this online work, and I can't imagine that could be true, but it is. And what it is, I think there's a safety in being in our own spaces anyway. And there's so much fun we can have. And the listening is so active. So coming into a session, so backtracking a little bit onto what you said, they'll introduce themselves, and then there'll be the intake questionnaires. All the different questionnaires are available on the dashboard, and I just love the app. The app is superb, and I don't know if everyone's noticing, but there are so many more features that are coming up all the time. They're always doing more things on it. I mean, there's just so much available now on the dashboard for providers. It's just superb. And I just love the way that the app records, and you can see on your dashboard what people are doing. And I mean, crazy. I mean, I do work with people all over the world, and it's crazy that someone can just press end session and straight away refresh mine, and whoop, yeah, I can see how many pauses you've done, how much. I mean, that is extraordinary. So big shout out for you. I think it's just superb how they're developing the app. And again, I'm not a tech person at all, I can promise you. I really am not. So it's easy to use. I find it easy to use, and clients do too. It's very user friendly. Anyway, so after the intake process, and I look at the questionnaires, and then the first session will be looking at the questionnaires, and I particularly like the intake form that from Unite that's got the bits that I go to first of all, and then I look with that in mind at the other questionnaires, is the bit that's about the responses that they have circled on the sympathetic and dorsal behaviours and features. That's where I go straight away, because I'm looking from a polyvagal lens, and so I'll see straight away how many they've circled on the sympathetic spectrum and the dorsal spectrum. And for me, straight away, I've got quite a good snapshot of what I'm working with. And then, so dorsal, big shutdown responses, sympathetic, hyper-aroused, and sometimes a good mixture. It's just like, oh, functional freeze kind of, that, you know, that hybrid state of dorsal sympathetic, which is very common. So then I'll start looking at the other intake forms, BBC sensory scales, body perception questionnaire, all those different ones that are available, and look at their sensory systems. And then again, I'm trying to build up a 3D picture of the nervous systems I'm working with. Because I'm always working with the nervous system. I don't get too involved in the story or the backstory. I'm very much working with the present now, their features and behaviours. And that keeps me safe from a polyvagal perspective. And state creates story, so that depending on what state they're in will depend on their story. And that's something that I work with them a lot as we move forward. So I'm mixing up lots of things.
That's very much the approach that I use too. That's very much nervous system orientated, and what's happening in the nervous system.
It keeps us safe, and it keeps us anchored, and keeps us engaged, and helps them understand what's happening, and helps them befriend their nervous system, because so much the medical world or therapeutic, and also the therapeutic world, certainly the medical world, can be very much we're working against, or we're doing to the body. This is, I want them to learn to understand their body, to understand what their body's telling them, and to befriend and not be frightened by these states. There's nothing wrong with a dorsal state. There's nothing wrong with a sympathetic state. They're really appropriate. Where it can become a problem is if they get stuck. And that's often the people that come to me, they've got stuck there. And it's how we're going to help lead them and their system to be able to work their way back up to ventral through the sympathetic state, from dorsal to that hierarchy system, from the dorsal ventral state through to the sympathetic to the ventral vagal state. That's moving through those states can be really tricky when you've been stuck in a dorsal vagal state for a long time. And it's that sensitivity and our understanding of that the sympathetic, again, I'm moving around too much. I'll go back. So it's when people come into my sessions, I've already got an idea of their nervous systems, and so I'm going to know how to sort of be with them in an understanding. I'm going to have tuned my nervous system into that, because I have to be in a very, very ventral vagal state. I spend a lot of time looking after my own nervous system before my calls. It's my responsibility to make sure that I'm in a really good ventral present state to be able to work with the nervous system that I'm working with, so that I can pick out all the nuances. I can go up and down with them with their energies, and really attune to them and validate their experiences. So so that the moment that camera goes on, I'm present, and straight away I'm looking at the cues. It's like, oh, we're going to be happy and bubbly, or oh gosh, have you been having a tough time? So straight away I'm attuning, straight away I'm going into where they are, and they're going to be, I hope, going to be met where they are, and they're going to feel heard. And that's often what clients will say, that they've never been heard in this way before, they've never been attuned to, that it's, you know, it's like the mother that's been missing, or I mean, they come up with some beautiful things that, you know, it's been working together. It's like, you know, and because I'm in the moment, so when they do then the beginning of the sessions will be very much looking back at their forms, and I'll be drawing on those things that they said with the dorsal and the sympathetic and ventral states. Which I'm not going to use the language, but I'm going to say, gosh, do you remember you circled some of those things? And I'll have written down beforehand some of the words that they've circled. Can you tell me what that felt like? And they might or they might not be able to tell me what that felt like, but I'll start saying, well, for me, what that means is, I mean, when you say agitated, it's like my heart's racing. Can you feel your heart racing? Some people will, some people won't. I can't hold my breath. You know, start inviting things so that they start knowing that actually it's not just me, it's other people as well, that there's a common thread, because some of these body experiences can be really frightening, and they've never explored them before. They've never been asked about them before either. No one's ever asked about my hearing, or whether I like to have labels in my clothes, or is it not just me? You know, all those things. Then there could be a lot of shame around, and so just opening these things up and talking about them straight away, it's like, gosh, this person's really interested in me in a different way, and I am genuinely interested. I am fascinated, and I want to be there for them and guide them. So I'm authentic. I'm not putting on a show at all. I really am present and really tuning into their nervous system. So by working those, sort of fleshing out, I start with the sympathetic. That's often easier for them to inhabit and tell me about, that anxious, all those different things that are on those forms, and flesh out where they might feel those. And then I'll go to the dorsal vagal, and I might not stay there for too long, depending on how comfortable they are, and then quickly drop to pick up, like Deb Dana does when she's doing the ladder. But most of my work is informed by Deb Dana's wonderful work. So go up to ventral again, and then so we get a connection again. And then in each state as well, I'll ask them to see if we can find some metaphor, again, like Deb works, that expresses that. Something like sympathetic, or it's like rush hour traffic or a roller coaster, and dorsal might be like thick gel or buried in the sand, and then ventral, connected and freedom, and you know, find something that really works for them, and you'll know when it's worked for them, because you know, carry on. I carry on with that metaphor piece until I've got something that really looks like, because it's theirs. I want them to own it. And that's the word that we'll then work with as sessions go on, because that's personalized. It's their experience, it's their personal experience. And then I'm tuning in. It gives me an understanding then of what it feels like for them and what their experiences are. So I've then done the mapping, but quite briefly to begin with, but we go back to that at the beginning of each session. And then we'll do some regulation together, and that'll be co-regulation. Again, I don't talk about it being that. And I said, we want some connection together. So what can we do? And I have got my Fab 4, if anyone's read this stuff, which I still do myself every day. And it's feeling your feet on the ground. And I'm just reading a beautiful, beautiful book by Betsy Hollerton called The Hugh Manual. And she talks about not being grounded and heavy on the ground, but actually feeling the support from the ground. And I love that, because that's got an upward feel to it, but you're still feeling that connection. So it's all about connection and feeling your sitting bones on your chair and feeling the connection, feeling the support. So that's the first part. And then the rocking. I love to rock with clients. Some people don't like rocking. And again, that gives me some clues about their nervous system, that they're feeling unstable. And then often as we progress through the sessions, they will actually like to rock. So it's always an invitation if they want to or not. And then just seeing how fast they rock. And I might, you know, if they're rocking fast, I think, oh gosh, we've got lots of sympathetic energy, and see if we can slow it down a little bit, and then maybe with a self-hug. And I can talk to them about oxytocin at some stage, Sue Carter's beautiful work and how it reduces. Sue Carter, Stephen Porges' wife, or Stephen Porges, Sue Carter's husband. Let's make sure we can say it that way as well.
Yes.
I love Sue Carter's work, absolutely superb. About oxytocin, and by skin to skin contact, the oxytocin actually reduces cortisol levels as well, which is so much part of our stress system. So again, it's psychoeducation in all these things at the level that someone can take it. If they can't take it, then I back off. If they're interested, I'll give it to them. So again, I'm measuring where they are and what the information they want as well. So I've never got a prescription about what's going to be. So isn't that interesting? So that's why I don't do medical practice anymore. I don't prescribe. I'm very sensitive to the actual person. I'm not going to just give a one size fits all sort of thing. And that's not disrespectful to my medical colleagues. It really isn't, because I'm not dismissing the medical work at all. It's just that this really fits with my way of working now. And then the breathing, oh my goodness, breathing. And I used to hate people to ask before this polyvagal work and SSP, breathing, because I was in a dorsal vagal state. I didn't know that until I learned about the polyvagal work. I couldn't breathe. I could breathe, but I couldn't do those breathing exercises that people wanted me to do. And that really upset me because I wanted to get it. And so now understanding that breathing, again, no judgment on breathing. We just listen to our breathing, and I invite them to put their hands on their chest and one on their belly and just sense their breathing. And by doing that as well, I can watch their breathing while I'm breathing with them. And it takes the attention off, but it's just like, whoa, so mine's in my chest more than my belly. I'll often say that, and it's often true because I'm not in a very I'm in a regulated state, but I've got a lot of sympathetic energy going on behind the scenes. But for them to feel that it's okay that I haven't got belly breathing, and it's okay, and then to do some Peter Levine's VU breathing if people feel comfortable doing that. But again, I'll do that with them because again, and Betsy Politon talks about that in her Humanual book as well. It's beautiful work because it's the vibrations, so we can talk about the vibrations going down. So it takes the emphasis off breathing we're making a noise, and often part of trauma is that we haven't been able to make a noise at all, and it's all to do with this area around the throat and the nerves, the whole social engagement system. They're all involved in this area. So and then the breathing and the diaphragm. So that the breathing side, and it's a fun thing to do. And people, I'm working with someone, a yoga practitioner at the moment, and she's, oh my gosh, you make breathing fun. I was just like, yeah. It's just like, we pretend that we're foghorns. She's on the Pacific, and I'll say, come on, you foghorn across the Pacific, and I'll foghorn across the Atlantic, see if we can meet. And just have some fun with it. It's just like, oh, I didn't hear that. But I do it with them. So they feel we really are doing things together. And then the final one is the of my Fab Four. So there's the rocking, there's the feet on the ground, the breathing, and then the final one is Stanley Rosenberg basic exercise, cranial osteopathy. Again, I don't do it in the proper way that he does, but I'll send the link to them. But that's a beautiful way of massaging the base of the skull. That's right. And again, then say, feel your feet, and that the body-brain connection. Again, just getting them to understand that they can go from one to another, and then breathe. And then, when we finally get through, we can do all four together. But some of them won't like any of them. Some of them, it's finding out what they will like, because that's really important. And at the end of that session, I'll write down what they did like, so that I make sure that I know for the next time what they liked, so that it's always in tune with what they want to. And then hand cream, we often use hand cream and the smell of a hand cream, and ask them to bring their different smelly things that they like different spices and herbs, even all sorts of different things. It's that sensory work that is so different, so that they feel relaxed and wow, this is different. And it's not talking therapy, it's sensory, and it's fun. It's about connection. So and
you do bring playfulness into your sessions, don't you?
Well, yes, Dan Hughes's work with PACE, P-A-C-E, playful, only if although it's the beginning of the word, it's really important that it's playful only if it's appropriate.
Yes.
so with a little p, but always accepting, which is the A, always curious, which is the C, and always with empathy, which is the E. So that work is, I love that. I always have that in mind. And that playfulness often comes in as we get more ventral vagal energy as well. The playfulness can come in, and the movement can come in too. And I have little teddies that often appear, and I'll have, you know, nice cozy throws to put around my neck. And I ask, obviously, have you got something you'd like to put around you? Do you have a nice cushion that you could just hug as we rock? Oh gosh, that feels nice. So inviting what they've got in their environment. Oh gosh, can I go and get it? Of course you can go and get it. Go on, off you go. You know, go and get whatever you want. You know, that's fine. Again, there's freedom within their homes, that they're bringing things in, and then often the next session, the things that they'll bring will be lovely. It says, oh, I brought this, and that's lovely. And it's so different. And so when you set up that,
it reminds me of show and tell, like when we were kids.
I was just thinking that actually, and it sounds a bit childish, doesn't it? But interesting, the show and tell. But it's interesting because, and certainly the members I've worked with as well, they have the loveliest teddies and different things, and it's beautiful to feel that connection with no judgment at all. And for me, I'm often thinking about that physiological kind of regulation that we do when we've got a baby. And we wait for their little whimpers. We don't wait for them to scream, hopefully. And we're looking for that attunement and that kind of care. And I think it's that meeting them in that place that, and people have reflected back at that's what it does feel like further on down the line, that it's that connection that they haven't had before. Because, and that's where my sessions, they are full on for me. You know, I don't give up 1 minute. I'm always watching whatever they're doing, and just like a you know, an attuned mother always watching for their newborn baby. And the show and tell thing, that's an interesting thing, isn't it? That childish kind of being seen, or should we call it childlike? Because we should be childlike as well. To have that trust, to build this trust, is so important. But I have so much respect for them. You know, it's an honor to work with them, and for them to open up to me and to be vulnerable with me. I'm going to really treasure that. It's such a privilege. So anyway, so we've got the states, and then we've got the regulation, and only then do we start drip feeding the SSP in. And I use SSP Connect often if people are anxious, for people to get used to the music, and they say, it's just music. Yeah, it's just music. You know, the SSP Connect without any filtering. And then Stephen Porges has just done this incredible filtering that's going to come in through so that your ears don't have to work to begin with. You know, I'll explain a little bit about it, but it's going to stimulate your vagus nerve, and we're just going to go very slowly. It's not going to be, we're not going to overwhelm your system. We're going to go to a level that we can integrate it. We'll stop and start. If in doubt, we'll stop. And that's really important, that we don't, to begin with, I often stop it before they even stop me. I say, can we just stop there? Oh, yeah, I just want to check in and see how you are. Oh, are you feeling anything? And sometimes people will be, but they didn't want to say. I say, oh, that's interesting. So if that happens again, just let me know and we can stop. Really? Yeah, because it's not about getting through the 5 hours. It's letting your system bed in and integrate and absorb what the music has to offer it. And so if we get away from the 5 hours and how long it's going to take, because the slower we go at the beginning, the better the foundations we build. Then by the end of it, we're going much faster. It's not going to stay at this pace the whole way through. But these early stages, really important that your nervous system is absorbing something different. Let's allow it to do what it wants to do, and so we can start reprogramming and repatterning. And we don't know how that's going to work. You know, and you were talking earlier on about the cellular level. I wouldn't talk to them about that unless that was something they were interested in, because that could be quite freaky. But it's that let's just repattern and just see what that feels like. So they start building up that trust again, and especially at the early stages, it's like, this music's going to change my life. This music's going to change my body. There can be so many fears around that as well. So to just back off again and just say, was that okay? Yeah, that was okay. Should we do a little bit more? And it's always an invitation. They're the ones that have got the choice. Another thing that I like with Deb Dana's work, she talks about having choice, connection, and context. And those things are really important, which is why I give the context, why we're doing the things that we're doing. So as I'm not doing to them, they understand it. And it's always their choice. Would you like to do some more? Would you like to stop? What would you like to do? And then the connection obviously is a huge part of this connection. So the listening is always very much an active thing, that they've got the headphones on. People will say, can I close my eyes? I say, well, I prefer it if we could stay connected, because that's, but sometimes when people have got severe dissociation and they're struggling with that, then we can do something so that they can look at me through the corner of their eyes. They don't have to look directly at me, but I can still see, I still got some sort of connection. We can do some moving around on the screens, and or some rocking or something that I feel that I've got some kind of connection with them. And I'll start someone with severe dissociation. I'll certainly be, dissociation is, I mean, it's a big thing, isn't it? Yeah, I've experienced a lot of it in my life, and it's a really important thing to honor and respect. We have to be take this very, very slowly then, because again, they might not have much feeling in their bodies. They can't, again, we have to really care for them, because they might not feel changes in their body that are actually happening. So then I might take it just 30 seconds at a time to just check in with them, see how they are, get them regulated again, or just bring them into connection in some way again, another 30 seconds, stop again, just to make sure that I'm not missing something, that they're going into a further dorsal state. You know, we have to be very, very careful with that. That really takes extreme care.
Yeah. So I'm just thinking, just listening to you, have you ever had experiences where, not talking about the client, we're just talking about who disassociates a lot, but some clients who maybe like, listen, I would like to listen a little bit longer than what we're pausing, because it sounds like you might do 3 to 5 minutes and then you pause and do a lot of connection work. But have you had experiences, then you listen again? But have you had experiences where some of your clients were like, oh, I think I'd like to try and listen a bit longer now? And
oh, definitely, because people want to get through the 5 hours. And which is where the psychoeducation comes in.
Yes.
It's so important that we're doing something deep here. This is profound work. This is a very important nerve that we're working with. We can't rush this. And I think the motivation for someone coming into this work, if they want to rush, is important. Like, what are they wanting to achieve? And to dig into that a little bit. But also it can be because there's a lot of sympathetic energy around, which is in a hurry, in a rush. And I mean, that's very, very common at the beginning. I feel like I'm a total nag. It's not easy. I don't find it easy at the beginning until we get into a bit of a rhythm, which can be after 4 or 5 sessions sometimes, when there's sort of accepted, like, because they notice there are changes. Because I have been, I on my watch, it's not going to happen, and the lovely thing about the app is that you can make sure that they don't listen to any other music in between times when you're not with them either. Because, well, going back to my experience when I had SSP, talking about my experience when I had SSP, this is what really informs it. So with my trauma background, I had wonderful body therapy, wonderful psychotherapy, learned about polyvagal theory, really changed my life and helping me understand what was going on during my trauma, the results of it as I was experiencing. So polyvagal theory helped me understand that very much. The dorsal vagal response, it's just like, whoa, all the light bulbs went on. It's just like suddenly things made sense. Then I heard about SSP and trained in it, and was concerned because I had a very sensitive system. I knew that. And so I taught my therapist about, I wanted him to sit with me while I had it, because I was just concerned about the impact of it, because I was understanding, well, if this is going to change things, I'm not sure what's going to happen. And during that, I think it was in the second session, and this was the old days, when we did an hour on 5 consecutive days, because it was right at the beginning of it. And after the first day, I mean, my hearing just was blown away. I mean, I went through a shop and I could hear a clothes shop, and I could hear every single hanger being moved on the rail. I mean, it's just like, so I was, and now it's just like, my gosh, was I overstimulated by it. The second day, I was just sitting there thinking everything was fine, and I was concentrating on the music as well, which I try not to do clients now. I don't want, the music's going to do its work anyway. You don't have to listen to the music and concentrate on it. But anyway, there was I focusing on it because I was wanting it to work. And I thought I was fine. And then my therapist said, "Are you okay?" And it's just like, but the fact was, I had taken the biggest dive down to dorsal and I was not there anymore. And I had not realized that. I thought I was absolutely fine. If he hadn't been with me and noticed my change in energy or whatever it was that he noticed and stopped, I dread to think what would have happened to my system, because that was really, really, really difficult experience for me. And having him with me and bringing me out of that was the most powerful transformative time. And that for me has always informed me. I know what that feels like. I had no awareness, although I knew my polyvagal theory, I knew my body, I knew my dissociation, I knew what dorsal vagal felt like. The music had done it to me and I had no idea, because it's a subconscious signal. It had happened, and the whole point of dorsal is you're shut down, you're numb, dissociated, all those things. And that had happened to me and I had no idea, because that's the point of dorsal vagal, you know. And it's not that I didn't know it. So that's why this early work, especially the early sessions, with any kind of history of trauma, it's like it has to be with someone else. They have to be keeping a watch for you. And that work, and when I have worked with people, and that's happened, and it often happens because of the mismatch, you're giving cues of safety through the SSP music, and because of our trauma backgrounds, those cues of safety are misinterpreted as signals of danger or threat. Our bodies go into a defensive place, sympathetic or dorsal, and that's what we're looking for, those shifts all the time. It's our responsibility as a provider to stop, because we can't continue. That would be an insult on their nervous system to continue that music. We have to stop, we have to connect, we have to regulate, and help them regulate, just like you would a little baby that's distressed. We have to be 100% where they are. And if they've gone into dorsal, you go into dorsal place with them. I mean, from a sympathetic place, from a ventral place, but you go with a dorsal energy from our own ventral place. But you go down with them and you bring them back up again. And the work that I've done when that's happened, and it can happen just like that, coasting along and then suddenly a drop. That's the most powerful transformative time, because you're to be in a dorsal vagal place and to have someone else with you and keeping you company, and someone can really disappear almost, and you just constantly talk gently, that you're there with them, using their voice, using their name, seeing if they can get a little bit of movement, a little bit of rocking, just something to slowly, because you know that they're going to come back up again if you're there. So you've got that confidence, but they haven't. But for them to finally come back out of that, and it can take quite a while, and then they meet you again, and knowing that they're going to go through the hierarchy, knowing that they're going to go through a sympathetic burst as well to come back up to ventral, we have to be there ready as well. If they want to then start moving around, getting up and walking, or whatever they feel that they need to do, you're there with them. You can take the laptop around with you while you follow them around. You are 100% there with them alongside, and then coming back. That experience and reflecting back on that experience, that can make all the difference in their whole journey of transformation and healing journey. And my gosh, as a provider, it's scary. It can be exhausting, and that's why self-care is so important. But you have just, you really have had the most incredible impact on that person's life.
Exactly.
But that's where the responsibility comes in. The music is the easy bit. The providing it and monitoring someone's space. So if someone does it on their own, which was your question, that's where my experience comes in. You don't know, and then I think that's where lots of the adverse effects can come from as well, because we don't know what we don't know. So if we haven't got body sensation, interoception, because it's been switched off because of trauma, and that's my experience too. But I'm always working on my sensory work, and why I love this work, to try and bring things back on board. But if people can't feel that, they can't report back. and we have to be aware of that. That's our responsibility as therapists. But I don't want to, it's time, this really is the far end of the trauma side, and obviously they're going to be a lot, so I don't want to give it a bad press or scare people off, because it's the most beautiful work, and because therapists will be integrating it into their own work, and most people I work with professional guidance that they've got their own therapies already, and it's about how they integrate SSP and drip feed it into their therapeutic processes that they've got already. So it's not usually like the way that I'm doing it. They'll do their body therapy or psychotherapy and just do a little bit of listening, and that little bit of listening with the relationship they've already got, and they'll know how to attune and regulate with their clients because of the therapeutic work they already have. That will be what's brings them back, but it's helping the client then understand what happened and to befriend that, and to know that that's not to be frightened of, and that a dorsal vagal response is appropriate to a life threat, and it kept them safe. They're alive now, and isn't it wonderful? And what we're trying to do is unravel it so that that is still available to them when the threat's appropriate, but they're not in that cycle on and being stuck there. We're trying to get them out so that they can go back up to ventral and get that and I used Deb Dana's flip chart and the diagrams in there to illustrate them so they can see over and over again what's going on, so that they know that it's not just them and the shame that can be involved and that it's just their story. It's like, no, this is part of the way that we're built. This is our defensive responses. This is our survival. We have survived. You have survived. And look what we're going to be able to do. So it's this message of hope that you were stuck somewhere, and there's going to be a fluidity to it. And then at the beginning of each session after that, I'll ask them about their week, and they'll bring usually some sort of story. I say, can we just look at that from a polyvagal perspective? So they start seeing their responses from a polyvagal perspective. Ah, that was my sympathetic response, or that was my roller coaster response. Okay, so now you had a roller coaster response. Can you see that? What could you have done differently? Or what did you try and do? Well, I tried to do some breathing, and then I'll create a menu for them, or they'll create a menu. I'll encourage them to make a menu for themselves. Like, so when you're in a sympathetic state or their roller coaster state or rushing out traffic, say, what are the things that really work for you to help you get back up again? What are the things that you're feeling in your body, so that, oh gosh, I start feeling different people who feel things in different parts of their body. It's just like I notice my throat goes dry, or I start racing heart, or I get a pricking sensation on the back of my neck. Okay, so that's your little whisper. As soon as that starts noticing, what can you do to start thinking, okay, I'm on my journey down into sympathetic or into dorsal, using their metaphors. What can I do to regulate myself, to bring myself back up again? So they start understanding that they've got power, and they're empowered to be able to bring themselves back up again, that this is not a one-way journey, that they're not the victim. They then are empowered. It's like, whoa, I can do it. And then as you build that in between the weeks, and then during the session you'll bring that in again, so that you can weave it all in, and so that the next session again, what will you put in your menu when that happens next time? What do you think might be helpful? Whether it's having a hand cream around, or doing voos. And a great friend of mine who was one of my guinea pigs at the beginning of COVID, with the online work, lovely friend and colleague, she said she did voos on the loo. I do a voo on the loo. And I tried that as well. Those awful bleak days of lockdown, and I'd have a little note by my loo says I did a voo on the loo, and voos in the shower, and all those different things. And if people are in a confined place because they're in a lockdown, that can be really difficult about how can you do these regulation activities. And so playing around with the things that you can do, going out for a walk, so you can do, another great friend that I worked with in the beginning of lockdown, and she'd go out for, we were only allowed out for an hour, but she'd find a gateway that she could go and do, and she didn't care who was walking past her. She was going to do that. She felt more comfortable doing that outside in nature. And there she was doing it. It's being creative about it, and fun as well about it, and knowing that you're looking after yourself. No one else is going to look after your nervous system. It's our responsibilities as adults to look after our nervous systems, and playing around with those things that we can do, and having some fun about it as well.
And I think that's
really needed in these times.
Yes, yeah. And I know when we've talked before about how you sort of, when you were describing your sessions and how you integrate this kind of work to support the SSP. I mean, you do have, you know, obviously you're within what's appropriate, but you do try and make it playful, and I think that really forms that sort of connection. I know one thing that I try and do with clients from the whole polyvagal is really sort of help bring that psychoeducation piece around the social engagement system, and really having them be aware, what do you notice in your face, your facial expressions, if you're frowning or smiling, or your neutral expression, and then then voice is a big one. Do you notice that you're speaking faster, and it's your breathing's up in your chest, and your throat's feeling tighter? Because I think voice is a big one to sort of is a quick one to tune into if you're feeling a little anxious, and then just trying to take a breath and slow that vocalization down. And as you slow that vocalization down, and makes you think clearly about what you're saying, and it's going to come into your breath. So our voice.
I think those are the kind of things. Those are the kind of things that I start working with further on down the line. Because many people coming to me don't have that capacity even.
Right,
and I talk about the window of, rather than the window of tolerance, I talk about the window of capacity, which I learned at the Boston Trauma Conference this year. And I really like that. And as the SSP starts working, because sometimes they don't have access to the ventral vagal system, and I don't want to put pressure on them to be able to do things that they can't do. But as those things start being able to open up, then, and that's just such a beautiful time when they start seeing, oh, I didn't know I could feel like this, or I haven't felt like this for so long, and ask them what does that actually feel like, so they really live it, and embed that experience. And it's then that I'll start tracking them and say, gosh, have you seen your face? It's just, look at that, and I didn't know it was possible. Because I've come in, they've come to me in a very different state, and I don't know what's available to them. And it's opening that up, just like, wow, and that delight, and it is delight. I get so excited. It's like, have you heard how your voice is? Ooh, and then we contract backwards as well. So then that becomes, they know when they're losing it. But if they haven't got it to begin with, you don't know what you don't know. If you haven't got that capacity. And for me, I'm not even sure that I could get there before SSP. That's why I love SSP. It actually was able to switch on my ventral system, which I hadn't been able to do before. I'd wanted to, but that's what SSP is so profound and extraordinary. That's why I just love it so much. It's the greatest gift, but it has to be done sensitively. But then to be, one way I like to look at it is trauma is a bit like a door slamming. And SSP is like sending a little note underneath that slammed door, and it's an invitation for the person to look inside and see if they want to see what's in there, and then they can have a little peek and then close it back up again, and then they can peek inside it again and think, oh gosh, it wasn't so bad, and then slowly they'll open it up, okay, and their whole body can relax and say, oh gosh, that wasn't so bad, and then eventually they might like to open the door a little bit, and then slowly that door will open, and eventually by the end and going on post SSP, the door will be open and there will be oil on those hinges, so it can open, close, it can, as it wants to in response to whatever's going on. And it's when that door opens and you see that beautiful social engagement coming on board, that's such a time for celebration, but also a time for loss, because change is messy. And it's really important that people realize that this isn't a straightforward linear journey, that there's consequences to change. And by, who was it? Someone said recently, I can't remember who I was listening to, that with every change, there's loss. And that's so important to realize, because you then realize what you didn't have. And the impact of that, and that's why therapeutic time around that and support is really important. When we start feeling things in our body that we haven't felt before, that's where the pain is. So we need time to be able to integrate that pain and what that means. The brainstem's opening up into the limbic system, the emotions, the sensory world that will be opening up. The impact of that is huge, or can be huge. So again, that needs time to integrate and to reprogram and repattern. And this is major work. And sometimes some people even say, 1 week, that's too soon. I need a couple of weeks to integrate everything that's happening. And I really respect that people are, for me, that is, wow, that's the absolute opposite of powering through. They're wanting more time. And that's the extraordinary thing about this work. Sometimes I'll do 2 or 3 minutes of listening in a session to begin with. I mean, it would be in segments, maybe of 45 seconds even, with breaks in between. The changes you can get from that. But then by the end of the 3rd hour, we're racing away often because of the impact. You know, we've got the firm foundations in the 4th and 5th hours. They can often do on their own because they don't need my care anymore, because they understand their state, they understand their sensory systems, they understand the integration, they understand the regulation, they've got everything on board. And I know that they're absolutely safe to be able to report back, to be able to do those things. And so after that, but the first 3 hours, those first 2 hours, and then the 3rd hour when the eardrum and the little muscles of the ear are coming on board with the filtered music, you know, those are very big areas of huge shifts and changes that we have to be really careful about. But again, please remember, I'm only talking about those with complex trauma, and there's a big spectrum between, you know, the little children with ASD and these adults with complex trauma. There's a big in-between times, and also people with their own therapeutic tools will have other ways of doing it. So this is only my version of things. I really want to say that I'm no expert. It's just the way that I'm doing. I'm still learning, and it's still evolving. And so that's just how it is at the moment.
Yeah. No, I appreciate you saying that, but I still think that regardless of how the intervention is being delivered, I think it being in a polyvagal informed approach just strengthens the outcomes, most definitely. And I had to say that was a beautiful metaphor with the little note under the door, and that was lovely. And I think what really comes across in your communication, Liz, is that lived experience, that not every therapist obviously has a background in trauma, that I think is really important for every practitioner who's going to be delivering this intervention to actually complete the protocol themselves, so they can sort of notice what unfolds in their nervous system, because it provides a different connection of then supporting clients in the intervention.
For me, it has to be done as an experiential thing as well as the learning. You know, top down, we have to be top down as therapists. We have to know that the language, we have to know the background, we have to know the science. It's really important that we do, to understand what we're witnessing with clients, so that we understand their social engagement system, the hierarchy, the neuroception. We really do have to know those things, because otherwise, you know, you just do. I mean, you wouldn't use any other tool that you didn't understand, would you? I mean, how would you do that as a responsible therapist looking after someone else's life, nervous system, their well-being? For me, you have to do that. But to experience it yourself, I mean, again, why wouldn't you have it for yourself? I mean, it's the most great, wonderful gift that we've got. I think it's just extraordinary. It's been so life enhancing for me. Why wouldn't we do that? And to do it with someone else, because why would we be different to anyone else? Why don't we deserve what our clients deserve? So to do it with someone else that can attune to us and regulate us, to do it together with, I mean, what a beautiful thing to be able to do, and to think that we could benefit from it. So it's that experience, and it's that bottom up approach and the top down. As therapists, we then really can deliver in a way that we're sharing then, and it's not just them and us, it's a shared experience. And we want the client to be their own expert, but we have to share that from ourselves. So I share a lot of my own experiences of what things feel like, because I'm a human being. I'm a human being speaking to a human being. I'm not, you know, we're equals, and they're going to be the expert. You know, I want it to be guided by them. That's why people call me, gosh, you're a wonderful Sherpa. And I think that's really lovely when people say that. And like the driving instructor, I do feel like I'm a driving instructor. You know, they talk about the ventral vagal, no, the sympathetic nervous system being like the accelerator on a car. I quite like the foot pedal to be the vagal brake, and then the hand brake to be, or people call it different things, parking brake. You know, like being put on by someone else, like like that dorsal shutdown response, and people often come with total exhaustion because they're driving with their foot on the gas pedal and the parking brake on. And so with the SSP, we're trying to take those off slowly. It's really important slowly, otherwise you're going to swerve all over the place. And so we have to start learning what that's going to be like. I worked with someone, beautiful person, who had, she was very sympathetically driven, and she said, "You're not going to change me, are you, Liz?" And I said, "You're a bit like a Ferrari, aren't you?" She said, "We're just going to try and get your brakes a bit better," because she was swerving all over the place. And that's the kind of laugh that we have. She said, "No, I'm not going to change you. You're still going to be a Ferrari, just with better brakes." Those kinds of ideas. And she was, at the end of it, a Ferrari still, because that's who she was. But she had better brakes. She wasn't dysregulating, to put it politely. In those ways, I'm an incredible person to work with, and we had so much fun together. She taught me so many lovely things about the hand massage. I learned a lot from my clients too about different things, and that's the lovely thing that we're sharing together. But I have to know my theory, and if I haven't experienced it myself, how am I going to know what they're experiencing? Really important. I think it's I'm honoring their system. This is working with deep stuff. The vagus nerve is a big chunky nerve. It's so important. It's the nerve that connects our brain and bodies. We're bodies with brains attached, not the other way around. We've really got to embody this work ourselves, I think, to give it the respect it deserves.
And that's why I think just doing a lot of that sort of sensory body work is so important. So I think we've been talking you've been sharing amazing information. So to move towards sort of closing up, I know you've shared that one book that you're currently reading, and I'm going to order it when we get off tonight because it looks amazing. But any other book recommendations you might want to share that you found that really helped inform your practice?
Well, definitely Deb Dana's books. She's got 2 books, well, 3 in fact. So I use the flip chart all the time. It's with me in every session. So her flip chart, I think it might even be available through Unite now, I'm not sure, but the polyvagal flip chart, I find that really good. And lots of clients end up buying that themselves as well, because it's so accessible. And her book on therapy, and then she's also got one on regulation exercises. So those are really important to me, and all the work that I do is very much informed by Deb Dana's work. Peter Levine's work, love it. And he's got a great book about memory, which I find fascinating, trauma memory. What other books? I'm Betsy Palatov, I'm just hooked on at the moment. Gabor Mate's book, When the Body Says No. There's so many amazing books out at the moment. I have such a list of ones, but Deb Dana's definitely for the delivery of SSP. And I mean, it's just coming thick and fast at the moment, isn't it? Just extraordinary, the amount of work that's coming out in the trauma world. I can't keep up with it, and I'm just fascinated by it, and I'm just so pleased that we are where we are now with the trauma world and how things are evolving.
I think Bessel's book is good, The Body Keeps Score. I know there's other books similar.
Sure.
His book I know really opened up a lot of learning for me in terms of how trauma gets embedded in the brain.
That's so important. I mean, that's one of the first, isn't it, that really integrates the work and opens up. I mean, when the body keeps score, the body says no. I mean, the titles say it. And it depends on the kind of work that you want to do. But as a therapist, I think the Deb Dana work helps from the polyvagal perspective. But the impact of trauma, absolutely, those books. And then if you want to go to the more science way, I mean, obviously Stephen Porges' books, and Ruth Lanius has got an excellent book. I mean, she's doing the most extraordinary work. She presented in the Boston Trauma Conference. I learned so much from her and her postdoctoral students in the Boston Trauma Conference this year. I mean, it's just coming out thick and fast. It's just, but I love neuroscience. So to see the fMRI scans of what was happening with people with trauma and the impact, and it's an exciting world to be in. And it's such a privilege to be able to do something that can improve people's lives. Exactly. And to really respect the fact that they've got to where they have in their lives now. I think that's the important thing, to celebrate every little shift they get, celebrate the fact they've actually got here, celebrate the fact they want to do this work, and there's so much to celebrate, and start an upward circle rather than often it's so downward. And especially at the moment with COVID, gosh, we need some hope, don't we?
Exactly. Well, this has been amazing. I think you've shared a lot of, valuable information that I think is going to really help practitioners implement the protocol. And then for individuals who are listening in as well, I mean, did you want to share a website or a email that if people want to contact you to learn more about your work?
Gosh, well, my website's desperately in need of updating, but it's Dr. Liz Charles. And I'll get around to doing that sometime. Yeah, Dr. Liz Charles, I think .com, something like that. And my email address, drlizcharles.co.uk, I think. I was expecting to have to say that. Yeah, and I love working with other providers, either to work through different cases or to see how they can integrate it into their practice. It's a real privilege to work with providers and support, and also deliver to providers. I mean, I do that, and that's really lovely, special work. That's some of the most exciting work that I do, because then you're working at a sort of I don't know, you I don't know, we bounce off each other a lot, which is really lovely.
Yeah. I do. We have in Australia and New Zealand, we offer SSP support. Well, I run some SSP mentorship groups, and I know one of the my regular attenders shares about that she worked with you to support her going through the SSP. So I think it's a different kind of process, isn't it, when you've got a practitioner, because they're wanting to understand it not only within their own body, but then how I'm going to be developing the skill set to support clients through.
And it's interesting, I have to be quite strict with providers as well, that I have to work body to body to begin with, and then we do the clinical work later on, because I have to really honour their system, and that because they have to experience it for themselves, what it is to be cared for and to be attuned to, and to leave their head and brain and clinical work, because they've got so many questions and things. It's what kind of session is this? This is delivery of SSP. This is a bottom-up approach. We can come to that. So it's segmenting those two, because I love integrating it and working at that level, at head level. That's very exciting. But I have to make sure that I'm working in a body-to-body, bottom-up way with them as well, because otherwise I wouldn't be doing the right job for them either. They wouldn't be experiencing what that was like. So right at the beginning, it's very explicit that we do those two pieces, but it's the most extraordinary work to be able to do, really special. And I love doing it as well, because then I know that that person really has got it, and then the way that they're going to deliver it as well, they've got it in their bodies, but they've also got the information, and so it's really special work.
Sounds amazing. Liz, thanks so much for your time. It was wonderful.
I hope I haven't confused you. I really do, because I feel like I've combined so many things that I haven't got in, like the work, I haven't gone in a linear way.
But that's okay. But then there's no only one way to implement this protocol. That and as you say, it's still evolving. I think we're all still learning, and the nervous systems that we work with are so complex that there's never going to be a one size all fits all. That we need to be eclectic in how we use all the different knowledges that are out there. Knowledges, that doesn't sound very correct grammar, but you know what I mean.
I'm certainly learning all the time, and I think if we stop learning, then that would be sad. It's that curiosity, and I got curiosity being such a ventral vagal quality, to be curious and to allow your clients to be curious. It's like, oh, what was that about? Or, and the one thing I want to say as well is, if someone yawns or sighs, celebrate it, because we spend, and that's something that really like, wow, that was a wonderful yawn. Sorry, it's like you try and stifle it, or a sigh, and sometimes a burp or something. It's just like, wow, it's starting to work. Those things that we've been told not to express, And it brings humour to it as well, and humanity. I think things like that, and it twists things upside down and inside out, and mixes things up. And it's not like there are no shoulds or oughts. It's just how we are. It's being together, and that's such a special thing. So I'm rambling again, but as you know, I should probably tell, I carry on talking about this. It is the most wonderful work to do. It really is. And I just hope all your providers that listen to this really have got something from it, because if not, I'm sorry.
I'm sure. No, this is going to be great. This is going to be great. I mean, there are a lot of people who would have listened to you on the remote delivery certification, and there's listeners all around the world who listen to the podcast, and there's practitioners, individuals, so this Unite send it out in a newsletter. Some of the episodes have also been sent out in the newsletter from the Polyvagal Institute, so we're just helping to sort of spread this information around. So some of the sessions have been very specific to the SSP, and then I've had some others that have been a little bit more sort of theory, just for us to learn about our bodies and about our nervous systems. And
it's an exciting world to be in. It certainly is.
Yes. Definitely.
Well, I hope this is helpful.
Again. Yes, thanks again, and hopefully we'll connect again in the future. But thanks again, Liz. I really appreciate it. I hope everyone enjoyed this conversation. I know I certainly did. For further information about Liz's work, her website is www.drlizcharles.com. So that is Dr. Dr. Liz, Liz, Charles, CHARLES, also all that was one word.com. And her email to contact her directly is drlizcharles@gmail.com. Again, if anyone has any questions or suggestions, please feel free to contact me directly. You can contact me at joanne@integratedlistening.com.au. And everyone stay safe. If you'd like to learn more about the Safe and Sound Protocol in Australia and New Zealand, please contact Integrated Listening Australia. The website is integratedlistening.com.au. And for the rest of the world, please contact Unite Integrated Listening at integratedlistening.com.